So we'll go ahead and get started. And really, what I want to start with is making sure that we're all on the same page. So, migraine is a genetic neurologic disease. Now, it is a genetic neurologic disease that can have many environmental triggers. However, I think it's really important, especially for this conversation, for us to emphasize the fact that it is a genetic neurologic disease, and that the things that we'll talk about now during this conversation, although they can raise the threshold so that it's less likely to have a migraine attack, it is not the cause. So, stress is not the cause of migraine. Specific foods or not eating is not the cause of migraine, but those are potential triggers or environmental factors that can lower that threshold and trigger someone to have an attack. But the underlying disease process is migraine, and this is a genetic neurologic disease. The other really, really important thing to stress by talking about migraine as a genetic neurologic disease that has environmental triggers or factors is that migraine is not your fault. So, whenever we start talking about these lifestyle recommendations and optimization of a migraine lifestyle, we want to make sure that we're clear that we are not saying by any means that migraine is your fault. Migraine is not your fault. When you have a migraine attack, the first question should not be, what did I do? How did I cause that attack? But it's a neurologic genetic disease that has resulted in an attack. And now we need to employ our different treatment options, whether they be medications, devices, or biobehavioral approaches to treat that attack. Okay? The next thing, too, is I always like to talk about the threshold of migraine. And so many people have migraine. It is a highly prevalent disorder. 1 billion people worldwide, 40 million people here in the US alone. However, everyone's threshold is a little bit different. So there's many people that have migraine attacks a couple times a year. Their threshold is actually relatively high. And then much of my patient population in my headache clinic has a much lower threshold for having a migraine attack. And so for them, really, they may spontaneously have migraine attacks, or very, very small triggers or a small amount of triggers can trigger an attack that is being caused by the genetic neurologic disease of migraine. So some of these lifestyle recommendations and optimization of your lifestyle can actually raise that threshold a little bit to make it less likely that you're going to have a migraine attack. In addition, medications that you and your neurologist and headache specialist have initiated, they also can raise that threshold even further. Because the thing is that weather comes through and you can't change that. And stress happens. Often you can't change that, although we can adjust the way we respond to stress. But still, these things happen. There's inconsistencies in sleep that happen. And so we want to raise that threshold for a migraine attack so much so that we can handle a little bit of variation, although we try to keep as much consistency as possible. But the goal is, of course, to keep that level of variation down here so that it doesn't trigger a migraine attack. So consistency is really going to be the key in this conversation today, because in a person who has migraine, our brain really, really treasures consistency. So I like to use mnemonics because it helps me remember things, and often I find that it can help other individuals remember things. So for lifestyle optimization, I like to think about the seeds for success in migraine management. So seeds, SEEDS. Each letter stands for something different, and that's what we're going to break down today. So what are the seeds for success in migraine management? The first S stands for sleep. Now, sleep is really affected in many people who have migraine. And it's one of those things that what comes first, the chicken or the egg? If someone has a lot of migraine attacks and has a lot of pain, it's hard to sleep. If someone doesn't sleep well, then that can trigger more migraine attacks. But it is really important that we do work on sleep for migraine management. So, what are the things that we need to work on? Well, again, what did I say? Consistency is going to be a very common theme throughout the conversation today. So, consistency is very key. We want you to try to fall asleep around the same time every night, to wake up around the same time every night. It's also really important to have good sleep hygiene. So, what does that mean? What is good sleep hygiene? Number one, it means that the bed is meant for two things. The bed is meant for sleep and sex. And so if you're laying in your bed and it's been like 15 minutes, 20 minutes, and you're unable to fall asleep, then I want you to get out of your bed and go into another room. Really leave your bedroom and go into another room and do something else, whether it be read. I would recommend avoiding screens. We'll talk about that in a second. But read or do a couple tasks. And then when you feel like you're a little bit tired again, return back into the bedroom, return back into bed, and hopefully you're able to fall asleep. That's called sleep efficiency. The time that you're in your bed should be when you're asleep. And the goal really is 90% sleep efficiency. So 90% of the time that you're in your bed, you should be asleep. If you're unable to sleep, get up, go outside your bedroom, try to do something else like read a book for a little bit, and then come back and see if you can get back to sleep again. Now, screen time. So screens, unfortunately, can really activate the brain. And so if you use screens within 1 to 2 hours of trying to go to sleep, you're going to have trouble going to sleep. So it is recommended that 2 hours prior to your planned bedtime that you should eliminate screens altogether and allow your brain to start to slowly decompress and go through that bedtime routine. And with regards to those sleep hygiene recommendations, keep that room dark and cool, and make sure that bedtime is a nice, consistent, prescriptive bedtime. Think of it as a prescription for migraine management. The goal is frequently stated that one should get about 7 to 8 hours of sleep a night, but the key is going to be consistency. So if you find that you will consistently get 5 hours of sleep a night or 9 hours of sleep a night, and you feel rested and well in the morning, that's okay. Keep that as your consistent number of hours. But the goal that's often published is about 7 to 8 hours for a good night's sleep. Okay, so the keys are for sleep: consistency, going to sleep around the same time, waking up around the same time, making sure time in bed is meant for sleep only, for sleep and for sex. And so if you're unable to get to bed, so that's the S, the first S. The next thing is the E. This is going to be exercise. So exercise is often tough for a lot of my patients with migraine, because for some patients it can trigger a migraine attack or exacerbate their underlying migraine disease. So it's important to know the statistics that exercise in general is good for health, and we all know that. In addition, there are a number of studies that show that specifically in migraine, that exercise can be helpful for reducing the frequency as well as the severity and duration of migraine attacks. In some studies, this was almost as helpful as some of our standard of care oral migraine preventive treatment options like topiramate or Topamax or amitriptyline or Elavil. And so why is that? Well, one of the hypotheses, is that exercise elevates levels of beta endorphins. And beta endorphins can be really helpful at dampening those pain pathways and reducing the frequency of migraine attacks, severity and duration of migraine attacks. So how much exercise is good? Well, if you currently are in a sedentary lifestyle, any exercise is good. And especially for my patients with migraine, I recommend starting very easy, very slow with minimal impact. So non-impact activities. Water exercise is great. So water aerobics or just getting in the water and doing some gentle stretches. There was actually a recent Facebook Live on AMF about stretching. That would be a great way to start incorporating some excellent exercise that is low impact for people with migraine. And then hopefully you can slowly work your way up. The amount of exercise in the studies that reduced migraine attack frequency, severity, and duration were 30 to 50 minutes of moderate intensity aerobic exercise, occurring maybe 3 to 5 days per week. So that can be a goal, but depending on what your baseline is, you can start with some minimal water exercises or aerobics, or even walking or gardening, or cycling or the elliptical, all these things that are very low impact. And just start with a little bit and increase your intensity as well as your duration of exercise a little bit and a little bit over time. Don't jump right into it. All right. Now, the second E in the seeds for success is eat, and this will include both food as well as hydration. So, with regards to eating, we're going to go back to that theme of consistency. So, consistency is key. You don't want to fast. You want to have routine meals throughout the day. And I actually encourage my patients to have 6 small meals throughout the day to try to keep that blood glucose level or blood sugar level nice and steady throughout the day and avoiding those peaks and valleys in your blood sugar, because especially those valleys can trigger a migraine attack. And there are studies that have demonstrated a correlation between fasting and a decreased threshold for head pain and headache attacks. So you want to have 6 small meals throughout the day, eating meals that are high in protein, in fiber, in healthy fats, low on processed foods. I know that might be hard in the current setting of the pandemic where maybe many of us have stocked up on processed foods that are non-perishable. But I think it's important to make sure that we bring some whole foods into our diet to keep us nice and healthy. Now, people will very frequently ask about food triggers, and I think that's a very interesting conversation. Now, things like red wine, MSG, processed foods, caffeine are very common triggers for many people with migraine. And if you find that there's a specific food or ingredient that's a very obvious trigger for your migraine attacks, it's good to avoid those things. However, don't kill yourself searching for the ultimate food triggers of your migraine disease. You may not even have any food triggers. And in fact, our learning and understanding about food triggers is changing over time. So, for example, we used to think that chocolate was a strong migraine trigger. However, with more recent studies, we've actually learned that there is a a craving for sweet foods, including chocolate, that occurs during what we call the premonitory phase of a migraine attack. So, craving chocolate may actually be a part of our migraine attack. And in the past, we interpreted that as I eat chocolate, I get a migraine attack. Chocolate is triggering my migraine attack. But in actuality, the truth might be that as I'm getting a migraine attack, one of the first phases of that migraine attack, called the premonitory phase, in which you can feel tired, have neck pain, have yawning, frequent urination, you may also crave sweet foods, including chocolate, as a part of that migraine attack, and then that later evolves into the pain phase of the migraine attack. So we still have a lot to learn about food triggers. I think the bottom line with food is don't fast, eat multiple small meals throughout the day. Make sure you're trying to eat as healthy as possible with lower amounts of processed foods. If there are obvious triggers, you can avoid them, but definitely don't kill yourself trying any specific migraine diet or finding all those specific food triggers, because through studies, there's never been any official migraine diet that has passed randomized double-blind controlled trials. And there's been no specific triggers that are applicable to everybody. Going back to what migraine is, it's a genetic neurologic disease, but everyone's genes are a little bit different. There are up to 40 different genes that have been identified that are associated with migraine susceptibility, and everyone has a little bit of a different combination. So my migraine disease is different from your migraine disease, and thus my triggers might be and likely are different from your triggers. So I think it's important to remember everyone is individualized in their migraine treatment plan, and some people may not even have any specific food triggers. And so I don't want you to kill yourself looking for food triggers in trying to manage your migraine disease, but rather just eat healthy, be consistent about meals. And with hydration, it's really a matter of keeping at a euhydration status, meaning that your body is taking in enough water to accommodate for all the losses of water through sweat, through urination, and through all the other body uses. And so the overlying recommendation is 8 glasses of water, each glass being about 8 ounces, so 8 times 8. So it's important to try to make sure you drink 8 8-ounce glasses of water throughout the day. Remember, things with caffeine is like negative water. So if you drink a caffeinated beverage, you want to actually drink an additional glass of water, because caffeine is a diuretic, and it actually eliminates water from your body. It doesn't count as one of those 8 glasses of 8 ounces. And caffeine can be a strong trigger for many people, as well as caffeine withdrawal. So with hydration, make sure you drink plenty of water. For many people, they need to incorporate some electrolytes in that water. So things like Gatorade, or G2 or Powerade or Pedialyte if you don't want the sugar. All of those things can be really helpful for people with migraine. Now, the next thing is a D, and the D stands for diary. So keeping a headache diary is so important for accurate diagnosis. And remember, for people with migraine, their diagnosis as far as being episodic or chronic or having menstrually related migraine, all of these things can evolve throughout time. And so your diagnosis, your specific diagnosis, might vary throughout your lifetime of having migraine disease. And having a headache diary, keeping a headache diary will help uh, your neurologist or healthcare provider helping manage your migraine, accurate diagnosis of your migraine, which will lead to specific diagnostic as well as therapeutic treatment options. And then keeping that headache diary will also guide those therapeutic treatment options. For example, if someone looks at a headache diary, if I look at a patient's headache diary and I see that every month they have 9 migraine days in a row, and then all the other days are headache free, then I know that I really need to work on their migraine attack treatment, because that 9 days of migraine headache is likely secondary to one bad migraine attack. So I need to work on treating their attack. In comparison, if there's a person who has 9 headache days or migraine days on their diary that are scattered throughout the month, then I know that I need to bolster migraine prevention for that individual. So that's why the diary is so important. Now, I understand for people who have very frequent migraine or daily migraine, keeping a diary is really frustrating and annoying. And people are like, what do you want me to write? That I have a headache every day? And so what I recommend for anyone, but definitely for those patients, is the easiest recommendation is what we call a stoplight diary. So you keep an old school calendar next to your toothbrush, and at night, and you have maybe 3 colors of pens there: green, yellow, red, or stickers. Sometimes people like using green, yellow, red. And at the end of the day, if you had no pain at all, which is great, then you don't put anything down. If you had pain that was mild, but you were able to function and it didn't impair your function throughout the day, we put a green dot. If you had moderate pain, a yellow dot, and if it was a disabling day, then a red dot. And for my patients that have daily pain, I always tell them that we're looking for the green revolution when we're flipping through their calendar to get more and more green days and eventually no dots at all to signify headache freedom if we can get patients there. But that stoplight diary is sometimes an easier way of keeping track of the not only number of headache and migraine days, but also how it impairs your function, green, yellow, or red. The next is stress. And so, of course, this is very, very important, especially currently during our current COVID-19 pandemic, which is very stressful for so many different reasons, for social reasons, for work-related reasons, homeschooling with the kids. I've got a 10-year-old. It's been quite interesting. He has his own Zoom calendar of all of his classes. And all of this has been, and the financial stressors, the access to healthcare, all of these have been quite stressful. And that's understandable. But it's really, really important to recognize that stress can be a trigger for migraine attacks, and it's important to try to manage that stress the best way possible. Fortunately, there are many virtual tools that are available that can guide us through mindfulness or relaxation techniques, biofeedback, and deep breathing techniques, using apps such as Headspace or Calm. And there's also some free resources that I can actually post on here for you. Let me just grab all of those. I have them saved on another document. So Dr. Dawn Buse, who has done some talks for the American Migraine Foundation, has a great website, dawnbuse.com. In addition, Dr. Rebecca Wells currently has a virtual mindfulness program that is available for all of you as well. So let me copy and paste that into the bottom. There we go. And those are some great resources that are free, that are online, and that can be very helpful. The other thing that I would recommend, and it's something that I'm trying to do myself, is limit the amount of TV that you're watching, especially the news. So it's important to know what's going on regionally and nationally, but I would recommend keeping it to 30 minutes in the morning and 30 minutes at night. And I literally, because I can get sucked in myself, I literally keep a timer to tell me when my 30 minutes is up, and then I turn it off and do some deep breathing and then move on with the rest of my day because the news can just be very anxiety producing and stress producing.